Kilburn. I'm a neurologist and neurosurgeon at the clinic here. There's 3 of us neurologists here. Neurology was something I got interested in vet school because it was a field where there was a huge amount of advancements in both diagnostic stuff like MRI and different therapeutics. And it's also one of the specialties where we can make a huge difference with intervention, like making paralyzed dogs walk again. I did my vet school at Guelph, and then a 1-year internship at PEI, and then my residency in neurology was down in Las Vegas for 3 years. I came back here and I've been here 7 years now. IVDD means intervertebral disc disease. That disease is a genetic degenerative disease. It's actually a chronic degeneration of the inner part or nucleus of the disc. The disc is the cushion sitting between the vertebrae along our spine, and the inner content, which is supposed to be very liquidy and act as a shock absorber, becomes dehydrated. The water leaves and the material becomes very brittle and sometimes actually calcified. So it's quite a chronic disease. The clinical signs develop acutely when the disc has degenerated to the point that just normal day-to-day activity like repositioning or stretching, just walking around, can make the disc finally pop. So the outer part tears open, and then the inner contents spit up into the spinal canal where the spinal cord is. The symptoms are a function of both compression on the spinal cord as well as contusion, which is determined by the rate at which the disc material herniates. Rarely is it ever associated with a trauma. This is something where we've had a chronic subclinical degeneration of the disc, and the signs just develop acutely once the disc reaches a certain point. The lining of the spinal cord, the meninges, has a lot of pain receptors, so do the nerves that come off of it, so compression and inflammation in that area is quite painful. Dachshunds are what are called chondrodystrophic, so just genetically they have early degeneration of the discs. It's sort of the same genetics that make them have the short legs and often bowed out arms like that. The symptoms generally include pain and varying degrees of neurological dysfunction. With pain, when there's ruptured discs in the neck, it's often spontaneous yelping, which is actually sometimes difficult to localize, or they may hold their head down or very guarded and stiff. And often the muscles of the neck appear swollen or are twitching. That's from muscle spasms, from the irritation of the nerve that innervates the muscles. In the back, they characteristically have a hunched back and often a very tense abdomen. The abdominal muscles will be rock hard, which is sometimes leads to confusion about whether they have an abdominal problem or a back problem. But if they seem uncomfortable and their belly muscles are tense, it's quite often due to a back pain. Less specific signs that are fairly reliable. The patients are usually reclusive, reluctant to go for walks or jump up and down on furniture, generally hide away because they can't effectively communicate that it hurts when they're picked up. The more obvious signs like neurological dysfunction can vary from an ataxic gait, which means wobbly, they sort of look drunk, and they can cross over their legs or knuckle their paws, to complete paralysis or inability to walk. So this is a lateral x-ray of a dog's spine. So there's the tail and the back legs, and this is the back here. So the spine is made up of a number of different bones called vertebrae, this one being different than that one. And the space between the 2 vertebrae there is where the disc lives. You can't see that on plain x-ray because it's a soft tissue. The spinal cord lives above it, right here. And so when the disc herniates, the material goes up here into the spinal canal, and the spinal cord traveling through there gets compressed. Most disc herniations occur in this area near the last rib and the first lumbar vertebrae. So this area right here is sort of the highest risk area for discs to herniate. In high-risk breeds like Dachshunds and so on, in almost every case, surgery is the ideal therapy. Surgery has a 96% success rate as long as patients have feeling in the back legs. So that includes animals who are painful to completely paralyzed. As long as they still have the ability to feel their back toes, surgery will get them back up and walking again. There's a common misconception that certain treatments like steroids or chiropractic can actually shrink the herniated disc or make it go back into place. But that herniated disc material is a foreign body essentially up in the spinal canal, and nothing short of surgically, physically removing it is going to get rid of it. So medications can certainly help with discomfort, but they don't actually make the disc go away, make the appearance of what a CT scan would look like any different. Medical management is effective in about 50% of the cases, so long as they still have feeling in the legs, although half of those dogs will have recurrence of signs later on. So medical management can be appropriate if the signs are mild and can be effective, but there's surgeries preferred to prevent ongoing injury to the spinal cord and reduce the chance of things progressing to irreversible injury. Because surgery has such a high success rate, and because they recover so quickly, it's generally the preferred treatment in almost every case, unless there's some concurrent medical disease that makes it unsafe for surgery. But the patients recover very, very quickly. One concern is, the morbidity and discomfort associated with surgery. But in general, these dogs are pain-free and off medications by about 10 days out of surgery. And usually when we take the stitches out 2 weeks after surgery, the biggest issue is trying to keep their activity, and they want to go back to being normal at that point. So they're really remarkable, much better than humans as far as their ability to recover. Dogs don't tend to be hypochondriacs, and they just want to know when they can go out and have fun again. This surgery is actually fairly straightforward. The procedure is called a hemilaminectomy. Remove a small amount of bone over the affected area, which gives us access to the spinal canal, and then simply remove that herniated material from the canal. So that relieves the compression on the spinal cord, which prevents ongoing injury and creates an optimal environment for which the spinal cord can recover in. In at-risk breeds like Dachshunds, at the same time, we'll also do a procedure called fenestration. The fenestration is Latin for to make a window. This is a preventative surgery we do to try and reduce the chance of these guys having another disc rupture somewhere else down the road. What we'll do is go to the non-affected discs and make a little cut in the disc and remove the inner portion, the degenerative material. So we don't remove the entire disc, but we remove as much as possible of the stuff that can herniate. This doesn't interfere with their function, but it reduces the chance of them having another herniation down to less than 5%. In general, sooner is better, but if the signs are deteriorating, then they need to be seen immediately, same day. If the signs are mild and not getting worse, then it's not an emergency. They can be seen as an elective appointment. But we sort of say you never go to sleep on a down dachshund. When a disc herniation is acute or just happened, it's very easy to remove. The disc material is just sitting free within the spinal canal, and you can remove it without even really touching the spinal cord. If the herniation's been there for a long time, like several months, it will scar onto the spinal cord, and so it requires a bit of manipulation of the spinal cord to tease free the adhesions. That can cause inflammation, which can slow their recovery after surgery. So certainly it's always preferred to address it early. It's just sometimes not clear whether it's going to absolutely need to be addressed early, which creates a bit of a decision-making difficulty. Generally, if we know there's a dachshund who has potential disc, we'll see them and pursue diagnostics and probably surgery the same day. So time's fairly of the essence, but even in dogs, as I said, even if dogs are completely paralyzed, as long as they still have feeling in the legs, generally we'll get them back up and walking with surgery. If it's mild and not getting worse, then they have the luxury of waiting to see if things can get better on their own. But even if things are mild, if they're getting worse, they should be seen right away. Unfortunately, there's no way to completely prevent this because it's something that's genetically inherent, the degeneration of the disc. And again, the actual extrusion usually occurs spontaneously, not associated with a trauma that could be avoided. So there's no way to completely prevent it, but certain measures that can help reduce the risk would be maintaining an optimal weight, trying to prevent them from jumping, which is easier said than done with dachshunds.
Very true.
And we usually recommend using a harness rather than a neck collar for leash walking so that we prevent the strain on the neck, because discs can rupture in the neck as well as the back. Most of our appointments are on a referral base, so they'll be referred by the primary family veterinarian. Patients can also come into the Emerge service, which is 24/7 here, and then they get transferred to the neurology service. Most appointments are made by referral from the primary vet. And again, we can often see patients the same day because we know that most of these are emergencies and have our schedule sort of set up to accommodate for that.